Drinking my lunch today.
We did.
I know plenty about that. I drink my breakfast every morning, actually. A good old bulletproof coffee.
No.
Awesome. So today, our guest is a world-class functional medicine practitioner with patients all over the world from Sri Lanka, China, and Australia. He's a graduate of Life University Chiropractic as well as Functional Medicine University, and is distinguished as a protege of Dr. Tent at Diverse Health Services. It is truly an honor to have you with us today, my friend and mentor, Dr. Jeff Senechal.
It's a pleasure. Glad to be here.
Thanks for doing this, man. I really appreciate it.
Yeah, anytime, man. Anytime.
So I do want to point out that I consider both you guys mentors. I've been in contact with you guys over the last several years, and you've been very helpful and quintessential to my practice. So I really appreciate that. So let's start out by letting our kind of listeners know, a lot of people aren't sure really what functional medicine is. So let's point out how this is a little different than the conventional approach.
Yeah, so it's, more of an integrative approach to kind of look at trying to find the real answer and the real causes to people's problems and health complaints today. And a lot of people go to their traditional doctors with symptom XYZ. They get medication for XYZ. And, as functional medicine practitioners, we want to know what's causing this. Why is it like that? You got fatigue going on. Okay, your thyroid's out of range. Why is your thyroid out of range? Is it an iodine deficiency? Is there something that's compromising it? Is there an autoimmune component to it? Is there some adrenal dysfunction with it? So it's about digging deeper and not pushing patients off to someone else, because unfortunately real doctoring today is just unfortunate, and people are just getting shoveled to specialists, still not getting any answers, and before you know it, they're just shoved with more medications today. And unfortunately, we're probably the highest medicated society around the world because we're so pharmaceutically driven, and every commercial on TV is medication this, medication that. So we just want to find answers for our patients, and you and me, we don't give up until we find those answers.
Beautifully said. I love it. In your opinion, you think functional medicine is the future of medicine?
Absolutely. Everything's going more towards evidence-based medicine and protocols in general. It's great. Even traditional medical doctors, some of them are waking up to this because they're tired of just prescribing and not getting results, and they're realizing there's more to the human body. There's no such thing as a Zoloft deficiency, no such thing as a Lipitor deficiency, and looking at essential fatty acids, B vitamins, D levels, and more of a whole body analysis and looking at the bigger picture versus throwing more meds at people. So for sure it's the future.
Awesome. I do want to make a point on this. You kind of bring up a good topic that a lot of people are jumping on board with functional medicine, and in my experience, just like anything else, functional medicine doctors, just like any other craft, they're not all the same. There are some that are very concentrated on their craft and continuously trying to learn, and make a difference in their community and continually to be open to learning new things. And then there's a bunch of them that are just kind of not even in it for that, and they're kind of half-assing it. In our clinic, 40% of our patients have been to other functional medicine doctors.
Mm-hmm.
They still are, out of pocket, lots of money, and they have lots of lab tests. They don't even understand really what's going on. What's your experience with that as well?
Similar, actually. There's some integrative doctors that are really good. There's other ones and that just, they don't even know how to read their own labs. They're trying to just sell very expensive care packages that aren't realistic. It's better than a regular pill and drug pusher, on all these other corners with the, traditional doctoring. But unfortunately, it's a little lucrative with some of the functional medicine stuff as well. And we have some guys locally around us that, they want to sell a $4,000 care package we've personally had some integrative doctors, very notable ones around the corner in our office, and they have always said, "You guys are way too cheap. You and Dr. Tent are way too cheap. Your first visit price should be $500-600." And Tent and I were like, "We must work for the people because we're not out to gouge on price and that kind of stuff." And it's we try to make things realistic for patients. People are out to, look for answers for their health, and they've gone down some routes, and even in the chiropractic stuff, unfortunately,
Yeah.
you see some of these people using those expensive traction devices, and they want to sell $5,000 care packages for 20 treatments with traction devices and that. And yeah, it doesn't take too much to see who's really in it to help people, and who's chasing dollar bills.
Yeah. Oh yeah. And usually whenever they're these expensive care packages, there's not much emphasis put on what you can do to maximize the person's own healing, and why they probably have back issues in the first place, especially with a big plan of traction on the spinal cord, and manganese is never brought up. You know what I mean? So it's kind of a no-win situation for them in the long run.
Yeah.
So now, you as a seasoned doctor, have you noticed perhaps over the last decade, this, our population's health just kind of slowly slipping to the worse?
Yeah.
How slippery of a slope are we on here?
Sick is the new normal, unfortunately, and it's very evident among our children. The increased rates of autism, cancers, and just how sick the kids and children are today. It's just no one seems to care, and it's the new normal. I try to wake and shake people up, like, no, this isn't normal. This isn't normal.
Yeah.
I'm like, I haven't had an antibiotic since my teenage years. I don't take NSAIDs for headaches. I'm not running every other week to get a Z-Pack for that, Z-Pack here, and maybe a steroid. This doesn't clear up type thing, and people don't realize the power of nutrition and chiropractic and putting them both together, how well things work. But people are sick and over-medicated today, and they are just dull to, thinking outside the box that this isn't normal. There's got to be something wrong.
Yeah. Do you see functional medicine as being an answer to that?
I think so. Absolutely, you gotta look more into your just general base of blood work and that. But even with functional medicine, and I know you've quoted it as well, you gotta treat the patient, not the labs. Some of these other guys will just want to, by no means am I bashing them, but they want to run multiple vials of blood work and kind of tweak little things based on the blood work thing. You got to really treat the patient and kind of know the body quite well. And even the nutrition is just, a lot of the guys who want to get into this, they underestimate the power of using real nutraceuticals and that kind of thing, and what they could actually do, and how well some of these things work better than an antibiotic, and don't create disruptions in the body. Of you do an antibiotic, you have fungal yeast issues, and vice versa. So a lot of cool things that you could use with it. But thyroid cases are a prime example, because I get a lot of Hashimoto cases, and had two just this last 2-3 weeks ago now. So they're being tinkered around with some other doctor with their medication. Think it's all Hashimoto's, but their symptoms aren't changing, and burning feet, fatigue, achiness, flu-like symptoms. And I'm looking at this, I'm like, you got mono. This is all Epstein-Barr stuff. I'm like, your doctors are chasing your thyroid because they see your antibodies are a little touch out of range, and they're trying to tinker around with your thyroid with some medications. I'm like, you're feeling the same for 4 or 5 months. It's not your thyroid. It's not your thyroid. It's Epstein-Barr. Same thing with adrenal health and thyroid issues with patients. I see too many people being tinkered around with their thyroid. It's your thyroid symptoms, hypoadrenal symptoms and hyperadrenal symptoms will mirror image thyroid symptoms. And a lot of these people are having more adrenal issues than it really is a thyroid issue.
Yeah,
and
exactly.
they work both hand in hand.
Yep, exactly. So this kind of brings me to my next question. Well, first, let me ask, what are the most common issues that you see in practice?
I did a muscle testing lecture back in the day, contact reflex analysis, and 5 most common things that we see. Staph infections, people carrying around bacterial infections on a regular basis. Gallbladder issues are very common. Kidney, what was the other ones? Gallbladder, staph, kidney. I'm trying to think of the other two. I know I always had 5. Strep was very common as well. Probably the top 4 we'll see. And it's seasonal too, obviously, wintertime. Things going on in the midst of the winter, sometimes early February, I'll see more seasonal affective disorder. You get your little seasonal things with flu, colds, pneumonias, cyclic things. It's funny to see the second week of September when everyone goes back to school, the first rounds of colds, upper respiratory stuff kind of goes around. Holidays come rolling around the corner, Thanksgiving, Christmas, people get stressed out, they're sick, they're together. You get your second rounds of things, you get the little norovirus kind of cycling around. You get a lot of gallbladder symptoms. Gallbladder is very common, November through January, clockwork, gas, bloating, indigestion, burping, belching, gurgling stomach, all these symptoms, GI symptoms that all their regular doctors say, you got IBS, have a nice day, keep shoving it along. No, it's your gallbladder, it's your gallbladder. Just got out of a room with a new patient. He went through the gamut of testing as far as all his heart doctors goes, and he's got pain shooting up his chest. I go, you got a hiatal hernia. I got to push your hiatal hernia down. I got to treat your gallbladder, all your symptoms. He's telling he's like, I'm trying to tell doctors all my symptoms are coming from down below and coming up, and I got chest pain, and they're all checking, running all these crazy heart tests on him, and everything comes back fine. We don't know what to tell you. I go, what do they tell you? They either told you everything's normal, it's probably in your head, or go back to your other doctor. He's like, yep, they told me both. He said, it's in your head, and then go back to your primary doctor. I'm like, exactly. This is what real doctors come down to today. No one wants to find answers. Everyone wants to shovel, to the next specialist, unfortunately.
If that patient goes back to the doctor after the original symptoms are still there, usually they get told they're depressed, right?
Yes.
You're just depressed.
This is why everyone's on these antidepressants and anti-anxiety medications because of this, unfortunately.
Yeah.
They're trained to tell you, we don't find answers for you. It's in your head. Your blood work, your labs look normal. It must be in your head. Have a nice day. I've never told that to one of my patients. Never.
And we can see that right away. And that kind of brings up my next topic. As a protege of Dr. Tint, you and I both use contact reflex analysis in practice. And Dr. Tint and I kind of discussed the origins of this yesterday. But I want to ask you, what kind of advantage does this unique technique give you as a functional medicine practitioner?
I love it. So that's, coming out of practice and work when Dr. Tent, trying to plug the holes and boost my nutritional credentials. That's why I decided to go to the nutritional route as far as functional medicine. What's cool about the contact reflex analysis is, and this is what I would explain to any integrative doctor around the corner that just wants to run labs and tinker around with little things and throw meds at people, is there's clinical problems and there's subclinical problems. You could run all the blood work all day long. You can run your CAT scans, MRIs, ultrasounds, whatever. You will see those problems on those clinical testing things. Subclinical symptoms is where the contact reflex analysis and the muscle testing comes in. Patients will come in with symptoms of things, yet if I run my blood work and do functional medicine type testing, I won't necessarily always find it on that. The contact reflex analysis and the muscle testing, I could pinpoint certain things because people will have symptoms of things and not show up on blood work. And a gallbladder issue is very, very a good example of this because, symptoms as far as gas, bloating, indigestion, going between loose and tight stools, burping, belching, gurgling stomach, and these people that are lumped with IBS type symptoms and pain here or whatever, a lot of that's gallbladder, but a lot of the testing with ultrasounds, hiatus scan, your gallbladder's got to be about 90% disease for it to even show up on that type of testing. So most of the time they'll say, no, it's not your gallbladder. I don't know what to tell you. You have IBS. Have a nice day.
Yeah, beautiful. And that's what I find it to be. Is it definitely gives you the physical problem of what's going on with their body right then and there, and it'll show you the priority too. And that's what I think is it's an invaluable tool on differentiating, because I can run a bunch of tests. For instance, just one thing, and I'll talk about it here in a little bit, but I do run GI tests and stuff like that. A lot of times they'll say negative on parasites. Okay.
Yeah.
A lot of these tests say negative on parasites. I had a nurse, male nurse from a different state, come to me about a year ago. And he was and I had to tell him, everything I do in this clinic is science-based, but it's not mainstream. You don't learn this in schools. You learn this from people smarter than you. And so he came in for GI problems. One of the first things that showed up was parasites. We ran some testing. He said, hey, you said I had parasites, but this lab test says not. And I said, well, that's the beauty of having this technique. He goes on an herbal cleanse and starts seeing all these things come out of him. And he was like, wow, how many things are we missing with testing? And I said, who knows?
I agree. And you bring up such a great point with that too, because I tell patients as well at the parasitic analysis on my Genova testing or whatever testing, doctor's data and Great Plains Laboratory. It's like these things could be higher up. You may not be catching this stuff in the stool analysis, and I'm to the point where I'm even trying to do like a provoked stool analysis to have them on parasitic stuff to kill things, to push it into stool so they can kind of catch this stuff. I was doing a 3-day stool analysis with Genova, so to give me 3 times to try to catch it, but it's an inconvenient factor for our patient too. They have to do that 3 times. But now Genova's got some PCR based testing. It's supposed to be a little bit more specific. We'll see, but still, that's where the muscle testing comes in. If you check for it, symptom wise, even full moon stuff, a lot of the stuff will cycle around the full moon. See this all the time with the kids. Pale complexion, dark range around the eyes, crabby, irritable fatigue, stomach and gut pains, itching the butt. The symptoms are there. That who cares what some of the lab testing says? The muscle testing shows, and you check for it, go for it. And that goes back to, hey, treat the patient, not the lab. That's another good example of that.
Yeah, beautiful. And again, back to the 40% of my patients have already seen functional medicine doctors. They come in and it's the same thing. Not to really bash anyone, but to be real of what's going on, is they have all these lab testing done, and they're trying to chase these little numbers. Meanwhile, the patient might have some improvements, but overall they still don't feel like they still feel something's way wrong, and it's because they're probably carrying something deep. So wouldn't you say the value of muscle testing, not only finding the problem and being able to evaluate what product they absolutely need as well? So you think that's
absolutely
golden?
You're golden for sure. And it's like I said, it sounds like you get bad, there's bad apples in any profession, and you get bashed certain ones. At the bottom line, we hope that and think that everyone's out to really help that person advance their health and get them better. But unfortunately, if you go to someone who specializes in thyroid, it seems like everyone that goes to them has a thyroid problem. Regardless if they really do or not. So, and that's not always the case.
Now, the thyroid, I've always been kind of told, you look at the thyroid as like a smoke detector in a maybe like a 2-story house. Okay, you got a 2-story house, and there's an upstairs bedroom and has a smoke detector in it, and that's about the same role the thyroid has. If that thing is going off and beeping, it's not because you need to go up and change the batteries. You got to look downstairs to the kitchen that's on fire.
Exactly.
So how often do you see patients who are misdiagnosed?
That's unfortunately, you would have to say on a regular basis. A lot of patients that you and I see, they got to get beaten. A lot of them just got to get beaten up by the medical side to even be open to someone more integrative or functional medicine, chiropractic, or whatever. So, we're the last resort for most people. And, a lot of times what we see is just misdiagnosis, or they've been given up on, oh, you got chronic fatigue, you got fibromyalgia. Those are great garbage bag terms of a diagnosis. What are they doing to treat you for something like this? It's just a term.
Yep, exactly. So you see a lot of people getting treated for the wrong things, and you bring up a value point. People coming in with fatigue, and they're running things on thyroid, and oftentimes it's Epstein-Barr. How often do you see that with your thyroid patients? 99 out of 100?
Very common. And, it's interesting because you look at some of the autoimmune factors with thyroid conditions. And when you get the TPO and the thyroid antibodies being up, that's one thing that I really do try to like to rule out is some of those viral panels with patients, especially the Epstein-Barr CMV aspect, because a lot of these people, sometimes they'll get this viral flare up and those antibodies or those things flare up as well. So some of these viral things will latch on that thyroid and shoot that up like crazy. Then, that's another thing where the muscle testing's nice. Muscle check. Is it a thyroid thing? Is it the mono? Which one's more active? Which one needs to be treated? So it's, you get to prioritize. The body will prioritize through the muscle testing which one needs to be addressed first.
Yeah, I love it. And I've seen, people misdiagnosed, but this is kind of the more extreme. I've had some patients think they're having a heart attack, and it's actually a gallbladder attack or something else. They're actually getting pain on the chest. And I had this happen last year to a patient who actually called me, and I quickly remote tested him very quickly to see, no, it's not your artery, heart. Those are all good. Gallbladder's red hot. And he happened to have some phospholiquid at home. I said, take a good shot of that. He put phospholiquid down his mouth. He went from having clenching chest pain to going out and singing karaoke in 2 hours. That's how good he felt, just being able to figure out what these reflexes are.
Yeah.
Very quickly. They give you a pinpoint accuracy. And
it's cool, man. It's versatile. When I first got into trying to learn his technique, the 80s and 90s, he used standard process. Early 2000, he jumped to biotics research. He kept changing his technique around so much it confused the crap out of people. A lot of people stopped following him. A lot of people that loved standard process and want to stick with standard process and not jump to when he went to biotics research. A lot of them went to do an NRT, nutritional response testing, with Dr. Freddie Ullin. And he recruits a unique group of people. If you've ever been to some of his seminars and that, so
it's all kind of doing the same thing, just a little different way. I personally think contact reflex analysis is just beautiful. I mean, it has been a substantial practice builder for not only finding stealth infections, for finding the priority with the diseased or sick organ, but also the spine as well. I mean, I've had so many problems with patients coming in, their neck is stiff, and you can go through and find the exact disc that's the problem. Man, to be able to find the disc that's the problem, put it back in place. And I mean, yesterday I brought up the point with Dr. Tent. Maybe you could even help a little bit answer this, but don't you see a lot of our population is grossly misaligned, even if there's, chiropractic
misaligned, they don't hold adjustments well. Everyone's rip, tear, pull, brokenness. Look at our athletes, rip, tear, bolt, brokenness, out for the rest of the season. We got a fragile generation of people, and they think they're the strongest generation. I'm like, no, you guys are weaker and weaker. You have no minerals, manganese, calcium, to uphold your ligaments and tendons, and it's rip, tear, pull, brokenness, out for the rest of the season. The funniest thing, I think last year they said in the NFL had like the highest amount of non-contact injuries taking people out. I'm like, I gotta break that down. Non-contact injuries, yeah, just running, turning, and tearing their ACL or tripping, turf toe, this and that. I'm like, are you kidding me? That fragile, no one's even hitting them, and they're just breaking things left and right. I'm like, holy crap, you gotta be kidding me.
And you really helped emphasize that exact point to me when you pointed out that gruesome leg injury that the MMA fighter Anderson Silva had on getting his leg checked by Chris Weidman. I mean, that was a world-class athlete, and probably in his prime, that guy could probably kick wooden baseball bats and break them. But being skinned, having low vitamin D, sweating all the time, eating empty food, and that's the injury that a person gets. And with all these athletes you're talking about, none of them have any idea about manganese, do they?
None whatsoever. And it's funny you mentioned that too with the sweating, because Dr. Joe Wallach talked about that forever, and 91 things you need, and because we always reiterate that with our talks and how everyone's fragile, how the soil's dead. Doesn't matter how good you think you're eating, the soil's dead. If it's not food, it's not in us. From what us eating it, and these athletes sweating all the time, and he's just like, you watch these athletes, they die in their 50s because they're sweating out all their life and sweating their minerals out. He's like, a couch potato lives to be in their 80s and 90s. They had their minerals. These athletes don't, because they sweat year after year. He pointed that out all the time.
Yeah, I mean, it's really something. Yeah, your couch potato average lives to be 78. And today a medical doctor actually lives to be 56. That should really tell you a big picture of what's going on. So
yeah.
So how often in your practice, how often are stealth infections missed?
Everyone carries a little bit of something around. Growing up, my life was earaches and strep throat. My mom being a nurse, every cough, sniffle, and sneeze was antibiotics in my life. Go hop on an antibiotic year after year is the same stupid infection. If where are you going to get your calcium? If you don't drink your milk full of mucus. Infection after infection. Like, holy crap, I had to break that train. It's like, well, these kids that come with these infections all the time, like, get them off the dairy. So yeah, Dr. Ten's been through a mess with his mouth. It's I feel bad. It's just he can't even win with these implants he deals with, and anyone that has to get implants, I highly recommend doing the bioavailability testing of seeing which composite works best for those types of patients. But he carries bacterial infections around. From the history of the antibiotics, got stuck doing the hepatitis B shot, working in the hospital. I have some small yeasty components that I go between this little bacterial yeast stuff. I know when certain things are flaring up. It's about teaching the patients when these things are flaring up. The mono patients, so you're getting achiness, your body aches, your feet are burning, your lymph nodes are up and down. This is that mono kicking in. Bump up on those supplements. If I'm slip up on doing some dairy or something, I'm getting more mucus. I feel my ears getting plugged. I got to play my stuff for the strep infection. Hammer away at this. It's everyone carries these things around. It's just to what degree you're carrying it around, and understanding what feeds these things. Like if you're a bacterial person, get rid of the dairy out of your life. It's gonna make you full of mucus. It's gonna feed that bacteria. If you're a viral person, get rid of the foods that are high in arginine. All that arginine crap feeds the viruses. Bump up your lysine. Get rid of the arginine. If you got the tendencies to yeast, get your sugar tooth under control. All these sugars and carbohydrates feeds that like crazy. And all these people, too many antibiotics, too many steroids, birth control shots, birth control in general, hormone replacement therapy, and hepatitis B shots feed this stuff like crazy. Or if they're pre-diabetic and diabetic and their blood sugars running like crazy, because it's just going to feed into that yeast like crazy with a lot of them.
Yep. So let me ask you this: what percentage of children do you see that flunk a hair analysis?
Oh, it's heartbreaking to even tell you. I'd say even with children and adults, 2 out of 10 children or adults, for the fact of the matter, come back with a clean hair analysis. Everyone's hit with something, whether it's bad, poor digestion or some sneaky heavy metal thing going on, vaccinated or even unvaccinated for that matter as well. So it's sneaky things, and unfortunately, certain metal toxicities, some of these children are unfortunately labeled as ADD, ADHD, autistic, sensory processing disorder. They get all these fancy names for it. What is the answers from the pediatricians? Well, this is today's new normal. Go to your psychologist, go to your counselor, hop on medications, and have a nice day. For functional medicine doctors like you and me, that's not okay. We want to find answers. We want to help these children. It's our future, and it's heartbreaking seeing what comes in our office on a regular basis.
Yeah, I fully agree. Look at the heavy metals, look at the minerals, make sure they have adequate zinc, so they have stomach acids, they have some kind of fighting chance against these stealth infections and so on and so forth. So I see the same thing. Most people fail that test right away. I posted one on Facebook a year ago, and I actually had a pediatrician go, wow, that's an interesting layout. I've never seen a test like that. And I was just like, well, of course not. I mean,
yeah, of course not. Yeah.
Yeah. So as a functional medicine doctor, how important is it to give people greater confidence in their own ability to heal?
You know, like Dr. Tuntz even said, people underestimate and underutilize chiropractic and real nutrition. It's amazing what you could do when you put them both together. And that's one of the biggest reasons I want to work and get under Dr. Tennant. Because when I was job shadowing doctors left and right, it's like, some were good at the chiropractic, some weren't as good at the nutrition, some were good at the nutrition, not as good at the chiropractic. And he had the best of both worlds and was able to put them together. And I was like, man, I got a mentor into this guy because, he just makes so much sense with everything he says. I mean, he puts a stellar lecture together and adds his politics, his humor, and all that stuff together. And it was refreshing when I first heard all that. It's like, holy crap, it's someone who
Yeah. And
knows
and my
that.
and my original interaction with this was, I mean, I had a best practitioner help me with some adrenal issues I had from being a combat vet and then working in a hospital as a paramedic. My stress was just through the roof, and I had a best practitioner help me out, and that really made me obsessed with this kind of world. And then I was in a meeting with Standard Process, and this gentleman said, you really want to help people. I can see you're here engaged. You're here before everyone. You leave last. He goes, you want to help people, don't you? And I said, absolutely, I do. And he goes, here, this never happened. And he hands me this disc. I take it home and I put it on, and it's a 1989 version of Dr. Versendal doing contact.
Yep. Oh, I got those. I still got those.
Oh yeah, the 1989 in Colorado when he's going through all the reflexes and how to use it, and I thought, this is it, man. This is what I'm going to do.
Yep.
I'm going to eat, sleep, breathe this the rest of my life, and it's been life changing. I mean, my life. I love waking up, doing what I do.
Mm-hmm.
My clinic is very busy, as I know you guys are. You guys do no advertising. It's all word of mouth. I mean, isn't it nice having people do all the work for you and just?
It's nice, and it was not, I think it worked timing wise nicely. Me coming in the office because I was the one who kind of kicked Tent in the butt a little bit to say, man, people need to hear this information. We originally put our stuff on YouTube for our patients' benefit so they could access it easier, but then we didn't see everything was just going to boom and go left and right the way it did. But it's been, like I said, it's just been a blessing, because then people are like, well, who practices here with what you do? And we try to make good referrals, and then we're looking at the supplements and things around. We're like, we don't even know what they're trying to do. So Tom and I are like, let's just start Skyping with them. We could definitely hammer a whole bunch of this stuff and probably do better than most of the people that we're trying to refer to anyways. And it's worked out great. But anyone who's, in the functional medicine, chiropractic, like yourself, we all have pretty cool stories about, what brought us into the profession. Because, you being a paramedic, I was a patient transfer for 4 years at a hospital, thinking I wanted to go into medicine. And the more I worked at the hospital, I was like, holy crap, this is sick here. This isn't healthcare. I'm like, it didn't take me long to wake up to this. I'm like, crap, I don't want to be here. I see people dwindling, getting worse, and just shove down more meds. I'm like, they're not getting better. They're just getting sicker within this hospital. So it's a car accident and getting neck pain is what woke me up. And I started seeing a chiropractor. I was like, I know traditional medicine is going to be painkillers, muscle relaxers, steroids, injections. I was like, now we have an opioid epidemic because of this crap of meds that they just peddle on everyone. Like, I'm not going down that route. The chiropractic adjustment, neck pain went away. I was like, wow, there's a whole different philosophy of healing from the inside out versus the outside in. The body's very powerful and has that innate intelligence if you give it the right things. Chiropractic adjustment, nutrition, it's amazing what it can do.
I know most people are completely they've never discovered this world. So when they come in and they get used to seeing, especially a contact reflex analysis exam, when you do that with someone, they look at their body differently. All of a sudden they're like, wow, there really is something here I didn't know. And it's like, yeah, your body's brilliant, and it has its own healing mechanism. It also has its own circuit board to let us know what circuits are blown, where we need to start. And that's essentially what the CRA is.
Yeah.
So Dr. Tent yesterday pointed out that kids today on the food they're eating just can't detoxify. How briefly, how important is it to make sure people are detoxifying today?
Yeah, with us being the functional medicine, you see the MTHFR mutation, the children not digesting, needing methylfolate, not having high amounts of glutathione, and problems with detoxification. Unfortunately, we see a lot of dead guts. People just aren't even digesting food, period. And there's so much within our food, the glyphosate, and it's creating a lot of this gut inflammation and problems. And like he was mentioning, chelating minerals out of people. And Ted and I are gonna go do a Facebook Live thing in about 12 minutes. And this is an X-ray of a patient who is in just this week.
I saw that.
She's not digesting her salt. She's taking a 1-a-day women's vitamin, thinking she's doing good for her body. It's going right through her. Synthetic vitamins going right through her system. And yeah, just imagine all the women saying, "Oh, my doctor says I just need a 1-a-day prenatal and blah blah blah, and I should be good." No, that's probably going right through you as well. I just can't X-ray you because you're pregnant, or you probably see the same exact thing.
Yeah, a high percentage of people coming in with synthetic junk, isn't it?
Mm-hmm.
So, what are your experiences with essential oils?
I use them at home a lot. We sell them. We sell them at the office, or we don't really sell them with the patients, but some more so. 'Cause I assume everyone has an account with like Young Livings and whatnot, so we don't get too much in the teaching classes or anything like that. They work great. Aromatherapy's perfectly good. It's been around for eons and that kind of thing. I got some of my go-to ones I like. Otherwise, I've got no problem with it. I got a mold lecture coming up in May, and they have been talking pretty heavily about tea tree oil, cinnamon, frankincense as some top essential oils to kind of help work with mold issues with patients.
Awesome. I've had some pretty good home runs with some that were actually very surprising. I'll send you what my thoughts are and see if you can find similar results with that. One more thing, I know you got a very busy day. As far as recommending a healthy way of eating, do you have a particular diet you favor over one or the other?
I stay away from any doctor who promotes one diet for everyone.
Yeah.
Fortunately, we try to make good referrals with patients, and we got some practitioners that everyone needs to be a vegan vegetarian, everyone needs to be a vegan vegetarian, or everyone needs to be keto. Everyone's, I kind of go back and forth, and I'll explain why certain diets won't work for patients. Most patients need a lifestyle change, period. I don't believe in a diet anyways. People more or less just need a lifestyle change as far as the food goes. Unfortunately, in America, the standard American diet, it's too much sugars. Everyone's getting way too much processed sugars, and they're not getting enough produce, fresh vegetables and fruit with that. So that's the bottom line as far as what works for patients. Paleo ketogenic works better for me. I feel phenomenal. Being February right now, the darker days of winter have always driven me freaking nuts. I hate darker days. When I started doing more paleo based things and cutting out my grains and sugars, start doing paleo lunches, I'm like, oh my gosh, I'm awake in the afternoon. It's amazing how much carbohydrates and sugar put me to sleep. I look at my blood work, I'm like, holy crap, I got the fun, lovely, genetic, crappy, high cholesterol that runs in the family. If I hop on the sugars and carbohydrates, and vegetarian won't work for me because sugars and carbohydrates are perfectly good with that. But if I eat that, it's still going to hijack and train wreck my numbers. My numbers just through the roof. I'm very sugar and carbohydrate sensitive. Keto and paleo work better for me, but there's patients that have certain food sensitivities. Say you got a gallbladder patient, a ketogenic based diet's high in fats. That diet's not going to work good for someone who's got a gallbladder issue, or people that have gut sensitivities to eggs and dairy. Certain things with the ketos not going to work with them. So I like looking at a hair analysis to look at how well they're digesting their minerals, to look at the hydrochloric acid. I like to look at the sensitive 7. Gut's everything, and us being functional medicine doctors, and understand the gut is a lot of your health. If your gut ain't straight, there's 2 things. If you got blocked liver pathways, or if you don't address your gut issues, you won't conquer any health thing that you're trying to get on top of, period. And I've yet to be proven wrong on that.
Absolutely. No, that's 100%. One more thing. Actually, I'm going to ask you what's the best way to get a hold of you, but I want you to share with us your favorite success story.
I'm really, there's days like I feel like I'm a health coach for a lot of people, and a lot of people just I feel like they just give up too easily. They give up too easy. And most of my days I'm not going to give up on you. Keep going. Come on. We're going to rearrange things. We're going to dig deeper. We're going to find answers for you. Go, go, go. I'd say probably about a year and a half ago, 2 years now, I had an 85-year-old patient with colon cancer, and diagnosed with colon cancer, 30 lymph nodes confirmed cancerous. They took a foot of her colon out, and they started to do chemo with her. Week and a half of chemo, she got so sick, she's like, forget it. I'm not doing this. I can't, my body can't handle this. I'm 85 years old, sicker than crap from this. It's like, oh, I'm going to go see this natural doctors, have them put me on some stuff. If I live, I live. I don't care. I'm 85 years old. I put her on a 90% plant-based diet, 10% meat, which was chicken, fish, turkey. We used GCMF with her and some other cool protocols within the office. 3 months later, her husband's like, she's got so much energy. I don't know what you've done with her. She has energy like this since her mid-40s. He goes, we've got kids, our children that live in Texas. We're going to go to the MD Anderson Cancer Clinic just to get another opinion from them to see what they say. Obviously, I can't monitor inside with her colon of what's going on with the cancer, but he called me with tears in his eyes 3 months after that, saying, I don't know what you did with my wife, but they can't find a lick of cancer in my wife. Whatever you did, there's nothing there. And everything was confirmed. 30 lymph nodes, the section of colon that they took out. He's like, you gave me my wife back, 85 years old. She could have said, screw it. I'm throwing in a towel. I give up. No, she didn't give up. She fought. So to any patient and person listen to this, never give up. Keep fighting. Go. Find answers.
I love it, man. Absolutely beautiful. Beautiful. Put some chills down my spine on that one. That was awesome, Jeff. So one more question. I'm gonna let you get back to work over there. I know you probably got a line standing outside your door right now. What's the best way for people to get a hold of you?
The website, diversehealthservices.com. I've been very active on the Instagram. You followed me on the Instagram. I show a lot of office stuff, and my Instagram stories do different themes each week. I'm on the Twitter, probably most active on the Instagram and then the Twitter. And, we got a social media guy who plugs in everything else from that standpoint. But yeah, trying to get a hold of us at the office, info at Diverse Health Services, our website, diversehealthservices.com. We got the YouTube channel, all our lectures and all that. So
awesome. Well, Dr. Jeff, my friend, thank you very much for spending some time with us today and looking into functional medicine a little deeper.
Pleasure, man.
Good seeing you.